5 new confirmed cases of coronavirus in Western Australia.
Move away from public places.
This is different to anything we've ever seen before.
A situation like COVID-19 being a global pandemic creates a lot of fear and anxiety. There's a lot of unknown around that.
Stay at home more. We're being urged to consider
COVID-19 relief.
Face mask is part of that protective equipment.
Information was circulating around in media, social media, different chat groups. We continued to need and provide community emergency response and in-hospital patient transport. So the business had to continue.
Everywhere you look, face masks have become an essential part of life under
surgical mask supplies at critically low levels.
Will the stockpile remain or will we run out?
We made the early decision to access some stock that is reusable and can be cleaned and used again.
We will be introducing today to our frontline staff in the metropolitan area personal issue protective equipment.
That's where the communication element about talking to the community about why we've changed practice, not only in the things that we're wearing when we approach them, but how we approach them in terms of keeping our distance to begin with, to get some simple questions to start with to understand where they've been and what their activities have been recently, before we engage any closer so that we're maintaining their safety and well-being and ours. There was a range of instructional packages that were developed. They were reviewed and updated again. There was some training that occurred with on-road staff, both face-to-face and online. One of our jobs continued to be providing healthcare to all of those people in Western Australia during COVID-19 and still today. So it was really important to us that we let them know that it's still safe to call us.
Call 000 in an emergency or if it's urgent, and we will be there for you.
And our operations centre staff were provided script so that they could understand and identify if there was any risk out of the community before an ambulance arrived to see that patient. We created a small fleet of isolation ambulances. St John Medical went to telehealth virtually overnight, which was fantastic, but we needed to be able to communicate with our patients and new patients around how they could access telehealth services. We had a pop-up on our website that had over 130,000 hits within a very short period of time. Over 60,000 people had an email sent to them how to access those telehealth services, and following that, an animation that talked through patients how to access telehealth services. The organisation shifted our approach with first aid training, so we sent over 4,000 emails out to different students that were enrolled in the course at the time to be able to advise them what was happening, and then we adjusted the way we provide first aid training when they came back. There was no more swapping on dummies. We had to maintain space around the mannequin whilst we're engaging in training, and all these activities, they were pre-communicated to our students, and also implemented the ability to conduct first aid training within the home.
For more on this, let's bring in first aid guru Aaron Harding from St John. Thanks for your time, Aaron.
One of the big fears in COVID-19 was how people would be affected within organisations. For St John Ambulance, we redeployed staff into different roles related to the response effort to COVID-19, and we communicated to our staff and volunteers that we still need your services, not only for the response effort to COVID-19, but to continue to provide ambulance and medical services across the organisation.
We couldn't do that without our amazing staff, our frontline paramedics and our volunteers.
With the fear and anxiety that came with COVID-19 and still exists with COVID-19, we managed to maintain our trust with the community. Being able to provide consistent, clear messaging, not only to our staff, but to the community that we serve is really important.
They know how to do their job, they know how to protect themselves, and they know how to protect the community.
We went into COVID-19 as one of the most trusted organisations, and we stayed with our community throughout this event, and will continue to be here when it's finished.